Thank you for that live report. A new advisory from the United States Surgeon General warning of an urgent public health issue regarding teen social media use and their mental health. This after a bipartisan bill was introduced in Congress that would ban children under 13 years old from using social media. Western Mass News reporter Kristen Burnell getting answers on what parents need to know about this advisory. Kristen.
Chris, Dr. Vivek Murthy says using sites like TikTok and Instagram present a profound risk of harm for kids. We're looking into some of the new legislation surrounding this topic that is being introduced at a federal level.
I don't think it's necessary for any child under the age of 13, maybe even a little bit older, to be on social media. I do agree that social media is a great place, to meet people with similar interests and connect with family members that you don't see often.
Local parents are speaking out after a new advisory from the United States Surgeon General, warning social media may be hazardous to kids' mental health.
If you're under the age of 13, I don't really see much benefits. Of course, I've read studies that say that it can link to depression, anxiety, lack of sleep, etc.
The advisory from the Surgeon General, Dr. Vivek Murthy, cited several studies which found correlations between social media and depression, anxiety, poor sleep, online harassment, and low self-esteem. He is calling for more research on the subject, as well as action by policymakers and technology companies. Lawmakers on Capitol Hill have introduced a bipartisan bill that would ban kids under 13 years old from accessing social media, and those between the ages of 13 and 17 would need parental consent to create an account. Meanwhile, Senator Ed Markey says he supports Dr. Murthy's advisory, which corresponds with his own legislative priorities. He wrote on his social media page, quote, "The research is clear. Young people are vulnerable online. Congress can't waste any time in protecting them. We must pass COPA 2.0 to create a kids and teens online privacy bill of rights." That bill he is referring to is something he introduced in Congress a few weeks ago, which would require a higher standard of data privacy for children to protect them from potential harms like exploitation and abuse. Parents tell Western Mass News they support any type of legislation surrounding social media's impact on mental health.
I do think it should be talked about more, but I would support that kind of thing.
Now, the advisory from the Surgeon General also recommends creating media plans and encouraging kids to develop in-person friendships. We'll hear from a child psychiatrist breaking down more social media insights coming up at 6. For now, reporting live in studio, Kristen Burnell, Western Mass News.